My name's Taylor. I'm going to be demonstrating how to administer medication through a PEG tube and also the differences between a PEG tube and an NG tube. The differences would be that for an NG tube, you always have to check for placement. You can do that by x-ray. You can also aspirate and auscultate. Also, you can check the pH. After you've checked the placement and you know it's in the proper location, you would make sure that the patient wasn't on suctioning. If they were on suctioning, you would always unhook them from suctioning. And then after administering their medication, you would wait at least 30 minutes before hooking them back up to suctioning. Now I'm going to prepare my medication, acetaminophen. I'm going to go ahead and wash my hands first and perform hand hygiene. And then I'm going to check my medication ordered by my doctor against my MAR. And it's 500 milligrams of acetaminophen. So I'm going to get out my medication and I'm going to pop it into my cup. I'm going to pour the medicine into my wrapper and I'm going to crush my medication because you want to make sure the pills are finely crushed so that they don't occlude the tube. I'm going to pour my medication back into the cup. I've got my water and my stir rod. I'm going to go to my patient's room. Knock, knock. I'm going to provide privacy. And I'm going to raise the head of my patient's bed to prevent reflux after I give them their medication. I'm going to identify my patient. Hey, Mr. Smith, how are you doing today? Can you tell me your name and date of birth, please? Do you have any medication allergies? I see that you are allergic to Demerol. I'm going to remove the site. I'm going to don gloves. I'm going to check for residual first in my tube. Come closer, Kat. I'm going to pinch off the tube first. And I'm going to attach my syringe. And I'm going to pull. And as long as the residual is less than 30, or it's 30 to 50, if it's 50 or greater, you have to notify the physician before you can give the medication. And then you actually always return, once you check to make sure how much, you return the residual. I'm going to return the residual. I'm going to clamp my tube back off. And now I'm going to draw up 20 milliliters of water to flush the tube. It says you can do 15 to 30, but I'm going to do 20 milliliters of water to flush my line. You always flush before you give medications. Make sure the tube is patent. Now I'm going to mix water with my medication. I'm going to also drop 20 milliliters of water. I'm going to put it in with my medication. I'm going to mix my medication up, making sure there are no clumps so that it doesn't occlude the line. I'm going to draw all my medication up, and then I'm going to make sure I've got the each shot with the tube. Then you can administer the medication one of two ways. You can either do it by gravity, which is where you pull the plunger out slowly and you hold it up and let gravity administer the medication, or if I hadn't done it that way, I could slowly push the medication. Also noting that before you give medication through a PEG or an NG tube, you want to make sure it is at room temperature. You don't want it to be cold or hot when you administer it. And then I'm also going to drop 20 more milliliters of water to flush my line again. Always flushing in between medications. You never give multiple medications at a time, and you flush between every medication. Once I've flushed my patient's line and it's patent, I'm going to lower their gown back. I'm going to leave them in a little bit of an upright position to make sure that they don't have any reflux, like I said. I'm going to let them know that, their acetaminophen should help with their pain, that if it doesn't, and their pain doesn't get better in about 30 minutes, to let me know, but I'll come back to check on them. Thank you so much, Mr. Smith.